dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about childhood immunizations, facts and fallacies, and also how to prepare for school. My guests today are Theresa, Calope, who is a public health nurse who coordinates the immunization program. And along with her is Bobbie Bagley, the Director of Public Health and Community Services. Welcome.
Thank you.
There's been a lot of conversation about immunizations and perhaps some misunderstanding about it. Why should people, and children especially, be immunized?
Well, Yvonne, immunizations have been a huge public health success for us. Vaccines are really important because they help prevent against vaccine-preventable diseases. So if we think about some of the things that have happened, approximately 322 million illnesses and 21 million hospitalizations have occurred. 732,000 deaths have been prevented among children that were born in the past 20 years. That's a result of a huge public health success as a result of our vaccines. There's also a huge cost savings to society that's estimated at about $1.38 trillion because it reduces the cost of disease, hospitalizations, days missed from work from parents having to stay home. So immunizations and vaccines are very, very, very important. The vaccines are not only effective, but they're also safe. But you know, nothing's 100%.
Right.
And so if we can create a community where the majority of people are vaccinated, those who cannot get vaccinated, those who are not vaccinated are protected.
Now, there's history related to vaccines, and I think there may be a misunderstanding that some of the things that people got shots for, they think that it's already taken care of, and these diseases aren't with us anymore. Perhaps you can clarify that.
Well, some of the vaccines, many of them, we've had some success with reducing the amounts of illnesses that we have seen. But we also have had some diseases increase, like measles, for example. A number of years ago, there was an outbreak of measles as a result of a child who was at an amusement park in Disney World in California, and that spread to several different states. We've also seen over the past few years some cases of whooping cough in infants. And so when children aren't vaccinated or don't stick to that vaccination schedule, you will see outbreaks such as those occur, which in the past we've actually been to the point of almost saying we can have those things eliminated. But when vaccines aren't administered on the right time and on the right schedule, we do see these types of outbreaks.
So when these outbreaks occur, do you have to treat them differently? I mean, are they occurring because someone hasn't received their vaccination, and then those that have already gotten it, are they in jeopardy of getting it even though they have the vaccination?
So once you're vaccinated, pretty much you're covered.
Okay.
So that's the whole goal. If we can have people vaccinated, then that vaccine will protect those individuals who may be exposed against getting the disease itself. It's the unvaccinated folks that we're usually concerned about.
And when do you start to vaccinate a child?
Oh, so Theresa can talk about our vaccine schedule.
Okay, when, of course, when the child got burned from the mom, they usually must, like maybe 90%, get vaccinated with hepatitis B in the hospital alone. And then as they proceed, like as early as 6 weeks, they can go to the provider, and it's a Schedule 1. And I believe one of our slides, yes, we have a slide of vaccinations that has been updated every year, annually, by the State Department and also in the CDC, Center for Disease Control.
So what are the most common vaccinations that children need to have right in the beginning and before they go to school?
Okay. So we have.
Okay, I can actually
Can
discuss
actually
this.
go through, yeah.
Okay, so in the admission for the child care from 0 to 6 years old, I don't know if this slide is, we can show it to the public, but usually the hepatitis
Yes.
B,
Okay.
and then the diphtheria, pertussis, and tetanus,
Okay.
and then what we call the Hib, Haemophilus influenza virus, and then also we have polio vaccine. And when they reach 1 year old, they need to have MMR, which stands for measles, mumps, and rubella, and also varicella, which prevent them from chicken pox. So these are the standard. And then when they grow older, we have some recommended vaccine by the Center for Disease Control.
And what are they?
When you reach like 10 years old, you need to have meningitis shot, HPV, and then they also, and annually, I forgot to mention about the flu shot.
Okay, so when a child, at what age do children have to show and their parents have to show that they've received the shots that they need to in order to enter into school? Does that apply to preschool too?
It applies to even daycares.
Yes.
Aha.
So you actually have to have the immunizations record to show for daycare because, again, the objective is to protect all the other children that are in that daycare setting. Because usually with some of these vaccine preventable diseases, it's contact, where kids are exposed. And so even in their childcare or in daycares, there's a recommendation for kids to be vaccinated before they start at those particular daycares. And then coming into school, their schools will make sure that they have the vaccinations that are required coming into kindergarten.
So parents come in with a document from their provider that shows them exactly what shots and at what period of time in their years they receive them.
Exactly. And the school nurse will also check those vaccine records. And if there's anything missing, the school nurse will notify the parent to say, your child is missing whichever vaccine they're missing, and have them either make an appointment to see their child care provider, or we will have families come and visit us at the health department where they can get their vaccines for free.
Well, talk about that, please. Is there a particular schedule that you have that you're open and people can just come and receive these vaccinations?
Yes. This is actually all in like the CDC website.
Yes.
And it's really easily accessed when you go online, type Center for Disease Control if they want to. But usually what happened, New Hampshire Immunization Program, they are really helpful in making sure that all the child care schools and public school system here in New Hampshire, they are aware about the requirements to enter school, and they are actually asking them to submit annually the immunization records so they can check if one of the child care is not following the advice from the CDC. So it's well controlled. And as you know, New Hampshire is ranking top when it comes to immunization, and we're really proud of it. We're like, I think we're ranking like 97%
97.
top
That's
5.
fantastic.
Yes, definitely. And we always do that.
Really?
We are a smaller state, so we're lucky to have that.
So because of that, are we therefore seeing less outbreaks?
We do see less outbreaks, which is good for us. We don't see major outbreaks of many of these childhood preventable diseases, and that's why we encourage parents to continue with that vaccination schedule and making sure that their kids are vaccinated. New Hampshire is interesting because as the Advisory Committee for Immunization Practices recommend, there are no children that are charged from birth up to 19 years of age in our state.
Really?
We're one of 7 states in the nation that provide free vaccination to children between 0 and 19.
So if somebody didn't have a pediatrician, they can come to you and you're open 5 days a week?
At the health department,
Yeah.
our clinics are usually on Tuesdays and Fridays. And the clinics on Tuesdays are usually from
4 p.m. to 7 p.m. and Fridays 8:30 to 10:30. And we also offer some outreach. like we go to some other parts of Nashua greater region,
Yeah.
and we do vaccinize them. But we get some
So you
schedule
go
with
out
the
into
van.
the community.
Go out
Yes,
into the community.
definitely.
That's
So, yeah.
fantastic.
So they'll see the van in their neighborhoods.
What does the van look like? What does it say on the van so that they recognize?
Actually, we have a picture there in the slides.
Good.
Hold on. And
Let's show that van.
we have some few pictures. We go to libraries.
We want to
and-
make sure you see these pictures as well.
And we're
And
going to
we
go right
also
back.
participate in community events, if
Good.
they, especially if they invited us. So for Nashua Public Health Department, if we get invited with some cities like Merrimack or Hudson, they usually invite us with their special event, and we can offer vaccine.
That's wonderful. And anybody can just show up?
They can, and if they do come, what the nurses really are going to be looking for is that a history of the vaccine, so a vaccine record. So if the parents can have that on hand, that's important because it allows for us to see which vaccines have already been administered, and it makes it easier. We can also call in to doctors' offices. You know, the nurses can call in, but it's easier if the parents come with that vaccine record. And we usually ask that if they're coming to our clinic on site as well, to bring some type of record that shows proof of vaccine.
Is there a particular criteria that somebody needs to meet in order to come and be able to get a free vaccine?
Just bring their child and
yes.
be the parent
And be the
Yeah.
parent
or the guardian.
or the guardian?
And they have to show documentation that they have the ability to sign to give permission for the nurses to give the vaccine.
And also, we also do screen them, definitely. Like before we give the vaccine, we screen them if they are having any issues with the previous vaccine. We have some guidelines that we need to follow as a nurse because that's our responsibility. We are responsible. If we give the vaccine, we need to make sure the client is not having any allergies.
Yes. Do you see reactions to the vaccines often?
Actually, for the past 7 years I've been with the health department, I rarely see them. And mostly it's more localized, like they have some soreness. And some of the vaccine, because of course they are not 100%, maybe 90 something, but usually it's safe. We see some client who faint, but I don't think it's really from the vaccine because sometimes kids go there in the health department and they haven't taken
They haven't eaten breakfast.
They haven't eaten
Or
yet.
they're anxious.
Yeah.
Yeah,
They
and-
get lightheaded.
Of course.
Yeah, so I'm
And we actually do, with asking, again, like Theresa said, the history of, from the parents, what happens when they've gotten their vaccines. Do they need to be seated? Do they need to lay down? One in particular with the HPV vaccine, which is for human papillomavirus. And we're going to talk about
Yes,
that
we
with
will,
you
with
in a
adults,
couple of
yeah.
weeks. With that vaccine, one of the things that they were seeing was that they were seeing some adolescents that were faint or pass out when they got the vaccine.
Now, you have some wonderful pictures, and you wanted
do.
to get back to them. And that was to be able to show people what the diseases look like.
Yes. And again, this is what we're trying to prevent and avoid from occurring and happening because, as I said, we've had some success with the vaccines over the years, but when folks aren't vaccinated, we do see certain things, like, for instance, with this disease. Do you have an idea of what you think this could be?
I
You
thought
see that picture?
chicken pox.
Chicken pox. You are,
Yes.
you are correct. That's
Yeah.
chicken pox.
So chicken pox is very famous, as we all know. Yes, it's a
It is.
highly contagious disease that is very uncomfortable and sometimes very serious. It can your child can have serious complication like dehydration, pneumonia, bleeding problem, infection, inflammation of the brain. And it can also cause that. So we're really lucky that we have vaccine that can prevent them.
Now, if an adult is in the company of a child that has chicken pox, that also can be a concern if they haven't had it, correct?
Correct.
And what do they need to do? So it's important for adults to make sure that their children are
But
vaccinated.
if they have
haven't been.
vaccinated,
Right.
if they get vaccinated, they don't need to worry. So
Right,
that's
but if
why
they
we are
haven't-
If they
encouraging.
haven't, though, they need to make sure that their children have.
Yes.
Is
And-
my point.
Yes,
Yes.
definitely. So varicella is like more on droplet precaution. And if they have like open wounds, of course, we need to make sure we're not having like contact with them.
Right.
So
and
we
it's
have-
spread very easily because it's carried on air droplets.
Yeah. Yes.
And so a person, you may not see any of the pox on their body, but if they've been exposed to someone, then they may feel malaise or tired. If a child's behavior kind of changes a little bit and they're just not themselves a few days before you actually see some of the pox break out,
Yes.
it could be because they're coming down with something. They may have a slight fever.
Right.
So those are all the signs that you want to look for before you actually might even see, the rash break out. But we actually don't usually see that because we have
they're
so
getting
many kids
vaccinated.
vaccinated. And so what we have seen, with any breakthrough or where the vaccine may not have taken, is you might see a person with just a few pox, maybe one here, maybe along the scalp, just a few, but those are still contagious.
Okay, so where do you want to go from here? We've talked chicken pox. What's
Got
the next
chicken
one?
pox. Okay, so what do you think
Okay.
that one is?
Is that measles?
Yes,
Is that
you're
correct? That
right.
is measles. And again, these are not things that we normally see, but when
Oh.
they had that outbreak in California, this is what they saw. And it was a multi-state outbreak.
Really?
Right, it's because when you go
On
to
a plane,
Disney World,
and
exactly,
everybody's there, and
exposure,
there are
and then you take it
people,
back
and-
home. Right.
And again, that's airborne?
Measles as well.
Yes.
Yeah,
And contact to,
So it's important that people have the opportunity to see what it looks like. That's what you want to avoid by
That's
getting
what you
your
wanna
measles
avoid.
shot.
Exactly.
And the next one that we should take a look at, just so that people can really see, by taking and getting vaccinated, you'll avoid this. What
I
is
think
this?
that is.
Yes. Do you want to guess?
I don't know.
It's German measles.
German measles. The difference between measles and German measles is?
For this, it's
Congenital.
yes,
rubella.
congenital, and if this is the one thing that the pregnant woman need to avoid, because it can affect all the organs of the developing fetus.
Cause blindness.
Yeah.
And again, the shot will prevent this.
Yes.
Is a shot, all the shots, just a one-time shot that lasts them all their life?
Oh no. Like for example, the measles. If you are 1 year old, then you still need to get a second. So it's like a boosting effect.
Okay.
So for lifetime, you need 2 shots for MMR, measles, mumps, and rubella vaccine.
Okay, so it's a
Cover.
combined shot.
Yes.
Okay, what else shall we take a look at so that we can let people see?
All right, so what do you think this is?
Is that the whooping cough?
This is whooping cough, and this is also very highly contagious. Travels through the respiratory tract, of course, when the cough. And it may seem like the kid is just having a regular cold, but then there's that whoop, whoop, that
Yes.
sound that it sounds really tough, especially when you hear babies with whooping cough or pertussis. And they actually are running a series of campaigns for vaccines for whooping cough so that the adults, because the adults are the ones that can spread it to the infants.
Really?
So you've seen the commercials where you hear the cough, 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 and it's just like, it's a sound that you just don't want to hear, in a baby. And so,
So
we
it
are
starts
actually
with adults and then goes to the
and go
children?
to the children.
So what
And
are the things that the adults need to do in order not to get it?
Vaccinate.
vaccine? They have to be vaccinated.
Now, should they have been vaccinated at an earlier age when they were younger and then not get it as adults? How does that work?
So we normally do get it when we're younger, but there's some that haven't had it, and so we're encouraging adults to get at least a second. Tdap is the vaccine that we give to the kids, and then for the adults,
Is that Tdap? It's a
Tdap.
GTAP.
tetanus, diphtheria, and pertussis. And as you can see, some of the vaccine,
Tdap.
yeah, maybe after 10 years they wane. That's why when you get your tetanus shot, you still need to get a booster after 10 years. So for CDC recommendation for adults, you should have at least 1 Tdap, tetanus, diphtheria, pertussis, for adults. And after 10 years, you need to do a booster for tetanus and diphtheria, because for adults, you have a lot of chances that you're gonna get cats and
I see. And for grandparents, are there any precautions that they should be taking or any
So for
updated
grandparents,
shots?
again, we encourage if they're going to be taking care
Right.
of infants to make sure that they have the Tdap.
Okay. All right then. Let's go on with the pictures because this is helpful. Oh, what's happening here?
So this is tetanus. So Theresa was talking about every 10 years making sure that you have that tetanus shot. This is lockjaw.
Oh, and that
And
comes
this
when
is-
you're bitten by an animal or other
Well,
ways?
this is when if there's a deep puncture wound into the skin, stepping on. We used to say like if you stepped on a nail or something like that. But if there's a deep laceration, basically you want to make sure that you make sure that your tetanus, your TD is up to date within 10 years.
So that is puncture. So what happens when you're bitten by an animal?
Rabies?
Yes.
That's
what
the
shot
rabies.
is given
That's a
for
rabies
that?
vaccine.
A rabies vaccine.
Yes.
And do people normally just get it, or they have to get it if they're bitten and you don't know if the dog has or whatever has been inoculated?
Yes. So if you don't know if the animal, the cat or the bat or the dog or whatever wild animal,
Yes.
which wild animals we know that they're not vaccinated, but for dogs and cats, then we do recommend the prophylactic treatment of the rabies vaccine for adults. And we can actually do a show on that one,
That
too.
would be good.
Yes,
So, but
because
if
people are starting, in fact, we've had bats. People are finding bats around their pets
attic,
and in their
their
homes.
pets, absolutely.
So we have to come back and do a show on that one.
Okay,
Yeah, we've
that's
done that in the
important.
past,
But
yeah.
if you are bitten by a wild animal or a
You do need
pet
to
or
be
whatever,
seen,
you do need to be seen
exactly.
right away and determine
Especially
if
if
a
you
vaccine
can't-
is needed.
We try to have people, if they can, if they can catch that animal, like for instance the bats, if you can catch it, then we can test them for rabies.
Okay.
But they will automatically begin the prophylactic treatment for rabies.
Okay.
By the way, if in case you get bitten by the animal, the first aid that you need to do is wash it right away with soap and water in a
That's
running water
important.
for 15 minutes, then go to the doctor. At least you're going to take off some of the saliva there from the rabid.
That's important
It
Yes,
information.
that is very important.
What other pictures?
Okay, do we have any more? And so tetanus for us in the U.S. is kind of uncommon, but we do make sure that folks are aware of the fact that if they do receive a deep puncture wound, that they do that one. And this is a picture that's actually from the 1960s, and it is a physician there with a child who has polio. And polio is one that we had really made some good advances with, and we're looking at, having it eradicated. We have seen that in some other countries, polio was on the rise, not here in the U.S.
Right.
But then we have travelers or vacationers that come through, refugees or immigrants that come through that may have been exposed to polio in their country. And so you may see someone that shows the signs and symptoms of having been affected by polio.
And what would those signs and symptoms be?
The weakness in their legs, paralysis. Sometimes they have a limp. When they walk, you might
Yes.
see someone, even as an adult, that may have had polio, and that's what you usually see with them.
Now, are children still getting the polio vaccination?
Yes,
We still
That's
Definitely.
all part of it. Okay.
It was eliminated in the United States in 1979.
Right, and
and
now-
the effectiveness of it, but you may still see it in areas where vaccine coverage is not as high. And Theresa mentioned here in New Hampshire, where we have a 97% vaccine rate, that's high vaccine coverage, which is awesome.
It
and we
is.
want to maintain that.
Absolutely. If anything, get even better.
That's right.
So what other things that do we want to show our audience so that
Well,
they
just
can
the
see?
fact that with the reason why, as a public health initiative, is important is because if enough of the population is immunized, because there's going to be a certain percentage of the population that may not be able to get those vaccines. It may be because of a medical reason. It may be because of immunocompromised condition that they may have. It may even be a religious exemption. But if we can have the majority of our population immunized, it protects those who cannot get the vaccine. And we call that community immunity. That's also important because even newborns, when they're first born, they cannot get vaccinated, but we can protect them against these vaccine-preventable diseases if everybody else around them is vaccinated, like the adults or the parents for pertussis. And then we have a slide that just shows what that looks like. We call it herd immunity.
Yes.
And again, if the majority of the population is immunized, the few that cannot get immunized will be protected.
So that's important at
That's very
certain
important.
times related to crowds and things like that when we
Yes.
talk about the flu season and everything else.
Exactly.
Not to go into
Yes,
crowds to
exactly
make
with
sure.
the flu season. And then Teresa's going to talk about the importance of, the childcare provider, our clinicians, physicians, nurse practitioners, why it's important to encourage vaccines.
You could see in the slides, child care providers assist the public health effort in ensuring the children have required immunization, and by reviewing health forms and immunization records at least annually, and also by referring vaccine-hesitant families to appropriate resources, and by reporting coverages rate to NHIP, which stands for New Hampshire Immunization Program, via the annual immunization report. So we really, those childcare provider, we really need them to be aware of this, and part of it, like this morning I went to a childcare visit and I did a immunization visit to them, and I did an education if they have any questions or concern about immunization. And actually, I was actually promoting also for the staff. I know this is not mandatory for the staff, but we're promoting the adult immunization for all the staff because they're the one who's taking care of the little one.
So let's summarize. We have 2 minutes left. The most important things that you want people to know about the importance of immunization and also preparing for school. What do you want people to do?
Start?
You want me to start? Well, we want them to get vaccinated because we know
Absolutely.
that vaccines are effective. We know that they stop the spread of diseases, and we know that we can protect our community when we have as many people in our communities vaccinated as possible.
And where can people get vaccinated?
They can get vaccinated at their pediatrician's offices, and if they can't get in because the schedule is booked out, they can actually come to our health department on Mulberry Street, 18 Mulberry Street, on either Tuesday between 4 and 7 or on Friday mornings between 8 to 10 o'clock. The community health centers also will provide vaccination for families and children as well.
And throughout the states, if someone wasn't in the New England area, they could go into any state and also receive these vaccinations from their pediatricians as well as their public health departments. All right, then. So how can people contact you if they have any questions?
All right, Theresa.
Okay, as you know, we have only 2 health departments in the New Hampshire.
Yes?
And one is located in Manchester, and the other one is, we are lucky, we are located in Nashua, and that's in 18 Mulberry Street, Nashua, and we're in a red brick building.
And the phone number for people to call? If they have any questions?
Yes, you can call directly to the Community Health Department, 603-589-4500.
And is there a website that people can go to?
It's our www.nashuanh.gov.
Okay,
And they'll find us under the community health.
and they can also get information about immunizations.
Yes, they can.
So the important thing to remember is vaccine saves lives, and it's important to be immunized for an entire community to stay healthy and well. Thank
Yes.
you so much for
Thank
everything
you,
that you
Yvonne.
do.
Thank you, Yvonne.